Ukrainian laparoscopic surgeons are learning the newest American practices. Specialists from Harvard University led trainings on best practices for laparoscopic operations, a minimally invasive procedure with a shorter recovery time for patients. To talk more about the innovative techniques shared, we're joined in the studio today by Vitaliy Poylin. He's a surgeon and professor at Harvard Medical School. Hi, thank you for being with us today.
Hi, thank you for inviting me.
Well, I'm really fascinated to learn about what are the new advances that your group of doctors are working with to pass on to Ukrainians.
So I came with my colleague who's a urologist, and we both specialize in minimally invasive surgery, both laparoscopic and robotic. And there are some newer things that we are trying to introduce and teach the folks here in both laparoscopy and hopefully eventually in robotic surgery.
And so what did you find? I know that Ukraine has what may be surprising to many, a fairly well-developed use of laparoscopics in the country.
Yeah, absolutely. Ukraine is not new to laparoscopy at all. There are plenty of surgeons who do that in pretty much all the specialties. There's definitely plenty of talent. Sometimes it's a matter of equipment. I mean, you don't often need much, but you need some. But there's still a lot of inertia, which is true for
any kind of. I mean, every doctor needs continuing education, learn new techniques.
Absolutely. I mean, we have the same issues where I am in Boston. I mean, where new things come in, and there is always a lot of skepticism. When I came here in April of this year after being away for about 18 years, and I almost incidentally ended up in a hospital, ended up helping them with some cases. And when I came, on one hand, what I was showing them in April when I was here, I think was very interesting to them because we do things slightly differently. Mm-hmm. On the other hand, when I came back to Boston, I was actually telling my folks how they do things here, because here oftentimes they miss things, but they also kind of lean and mean. You get what you need and you work with it. And down there, we oftentimes have an excess, and at some point, the excess ends up being detriment.
Absolutely. And I've been in the kind of situations where I've seen that. I mean, my own personal stories, just even seeing going across the border, say Washington, D.C., and you see what the equipment is for one ambulance. You know, D.C. ambulance, it's stark, it's exactly what's needed, versus across the line in Arlington, they'll have so much more. And it's really fascinating to see how do they get this done with less? Mm-hmm. And there's that more of a focus on the basics that need to be done. Mm-hmm. So what I know that a lot of the colleagues talked about not having seen American techniques. And what were you finding that the Ukrainian colleagues were most fascinating with, or the techniques that you saw changed over quite well?
As you may know, in medicine, there are kind of schools of thoughts, and sometimes how we think about an issue and problem is very different from Europe, and it can be very different from Ukraine. So oftentimes the folks here are taught by more kind of a European school and how we approach things, or, you know, I'm a colorectal surgeon, so how do we take the vessel, how we take the bowel, what do we use? So, and it's oftentimes the little details that are different. The principle is the same.
Right.
The details may be different, but this is where you oftentimes, you know, the devil's in the details, right? This is when you can actually go a little quicker, or be a little safer, or, you know, something like that. So.
And what were some of the things that you yourself picked up from, you were saying in April, that you picked up that were of interest, that you discussed with your colleagues?
So, coming back to the issue of access, pretty much all the instruments and everything, not the instrument necessarily, but a lot of equipment what we have is a single use. There's nothing wrong with that, but it definitely costs more money. There are a lot of instruments that can be made metal, that we don't have to, you know, throw away and buy a new one every time. We've been using them yesterday and today. It's, you know, the same thing, except it's it's probably been here for 20 years and it's still just as good. And
Right.
for every case, I have to open a new one.
Right, and this is an issue in American medical system is often excess. I mean, it's very beneficial to the people selling the equipment.
Right.
Right. And so when you're in this case here, often in Ukraine, with having to use something long term and do it in the safest way, metal is often a good way.
Yeah.
And so recently you're here for a 3-day forum. Tell us about this forum and the process and what the outcomes have been.
So ever since my visit at the regional hospital in April, I've been essentially talking to the folks there in the department almost weekly. Sometimes for consultations about the patients, but there were two other things. First of all, there was definitely a lot of interest and enthusiasm for me to come back and to help them and teach them with some things and bring other folks if we can. But what was kind of interesting to me wasn't just there was an interest in learning some new technique, or getting some new toy. And part of the reason I agreed to do that is seemed to be a lot of interest in making changes that can be beneficial not to individual patients that we're operating on today, but to hopefully the whole city and the country in general. We do have a lot of sometimes often excess, sometimes extra regulations, but there are some things that have been proven to be beneficial, and for both patient care, immediate patient care, recovery, return to work, return to being a functional member of a society, and but it goes against the tradition. And it's true everywhere, but in the United States, we've really been making a lot of effort, especially I think in colorectal surgery, in trying to promote evidence-based techniques.
Right.
And what I saw a lot of enthusiasm to introduce that here. In my only pretty much the only kind of a rule that I made for them, and like I said, I'll come, we'll do this stuff, but again, we can help a couple of folks when I'm here, but if you agree to make the changes that we know, we'll adjust them to Ukraine because obviously it's a little different. But if we can start making changes and hopefully go from regional hospital to a bigger audience, then that makes it worth it.
Absolutely.
For me.
Absolutely. So. And what we're seeing with the health reform, which has been one of the most successful reforms, is from looking into it, from talking to doctors, are seeing that there's a lot more enthusiasm because they're able to make changes. They have more desire because they see that they can make changes that are implemented. They can have a say to improve the system. So I would imagine and I would hope that this will definitely, this isn't just saying, yes, we'll do this, but actually they have the means now to be able to do a lot more to implement these things. And
I think the folks here also organized the fund to help hopefully fund some of these activities going. There's been a lot of talk about the robot, and we're not in Ukraine, and we have multiple hospitals that would have plenty. And I think at the end of the day, it's a tool, but it's an extremely useful tool in a lot of different settings that can significantly benefit the patient. So it's a balance, right, between
excess
right. Too much and too little, and
as
with everything else, truth is somewhere in between.
Yes. And I know that the doctors performed at least 5 surgeries, but this wasn't so much. This wasn't just set to this, the number of doctors. There was also a streaming of this.
Yes. Yes, there was the whole conference organized, and the folks from Kiev, but as well as from other regions, came, and we have lectures for them. Oftentimes, actually, one of them is related to some of these pathways, and we're hoping to. They started to implement at the regional hospital, hoping to some of them to more with technique, and then we live streamed the surgeries for both me and Dr. Koretz, the urologist. And then when we come back and do the lectures, folks ask questions. They actually ask us questions live, and we can kind of point things out if somebody has a question of why we do that. Because reality is some of the patients that we both had for the past 2 days were little challenging, but that's also the reality of
which is can be. It's better to have some. I mean, challenging because the things. Those have the most questions, I would imagine, and also they're techniques that really can be useful. What do you say? You see the most challenging, and you can apply that to the. So if you can handle a challenging case, then you could probably handle.
We also, I mean, well, we're not salesmen. We're not trying to sell them laparoscopy. What we're trying to say, like, these are the cases. You start with that, but this is what you're going to get as well, and you have to kind of know things. Like today, we actually converted one of the cases, and I was explaining to folks later on, I didn't think it was really safe to proceed. So at the end of the day, I have to do what's right for a patient. Doesn't matter if I'm here, and showing out with people or I'm back home.
Exactly. And is this information, will this streaming be saved that can be used in training and doctors can continue to use this?
They're recording the videos, the hope is for folks who I've been talking to, and we've been working on some of the pathways here and everything else. We're actually in the operating room and helping. So I'm hoping that combination of things will allow us to keep on going. There's definitely a talent and desire, which is good.
And what's next? What do you see or hope to see in the future? Perhaps exchanges, depending on funding, exchanges to the U.S. or more forms. What are you hoping will develop?
I think ideally it would something that would go both ways. That we can bring folks to U.S. to do some more formal training courses, whatever it's robotic or laparoscopy or anything else. Do hopefully more frequent visits here with concentrating on teaching folks at the regional hospital as well as other places, and along the way again developing these pathways that we can start hopefully working on improving care, improving recovery, improving safety, which is very important, kind of all incorporating it at one.
Oh, wonderful. Thank you so much for joining us, and I look forward to seeing how this develops in the future.
Thank you for inviting me.
Thank you. And that was Dr. Vitaliy Poylin. He's a surgeon and professor at Harvard Medical University, specializing in laparoscopic procedures. Thank you for watching, and stay tuned for more.